Hello everyone, welcome back. Today I'm going to talk about pain. Pain is one of the first human complaints occurring in daily life. Pain is an unpleasant experience associated with actual or potential tissue damage. It may arise from accident or injury, cancer, arthritis, a multitude of physical ailments, or even emotional distress. It may affect the head, neck, torso, or any of the extremities as well as internal organs. So, how does the traditional medicine explain the occurrence of pain? The body maintains a balance between the principles of yin and yang and between qi and blood. Qi and blood travel through the body along the channels. When there is not enough qi and blood, or when they are stuck in one area, the pain will develop. The basic statement about pain formed almost 2,000 years ago. If there is free flow, there is no pain. However, if there is a disruption of this free flow, then the pain occurs. Free flow is the statement refers to the free flow of qi and blood. Pain, whether acute or chronic, could have a variety of causes. Today, we're going to take a look at some common causative factors leading to pain and how do they create that uncomfortable feeling. Causative factors leading to pain include external pathogenic factors, emotional factors, internal organ diseases, and miscellaneous pathogenic factors. First of all, external pathogenic factors. There are different external pathogenic factors, mainly wind, cold, summer heat, damp, dryness, and fire. Invasion of external factors usually occurs because of two main reasons: weakness of Zhen Qi and too strong pathogenic factors. How do these factors affect the circulation of qi and blood? Let's answer it. When wind, heat, and fire, the yang pathogenic factors, invade the body, they accelerate the circulation of qi and blood, creating an abnormal circulation and local congestion of qi and blood. This may cause eventually blockage in the qi and blood circulation, and so pain develops. Cold, a yin pathogenic factor, is characterized by stagnation and contraction. When cold and excess cold invade the body, there is a decreased qi and blood circulation and also spasm of the channels and blood vessels. This slows the circulation of qi and blood, and pain eventually results. Damp is characterized by stagnation and viscosity. The reason of damp, whether caused by external invasion or by dysfunction of the internal organs, may slow the qi and blood circulation because the channels and blood vessels become narrowed, or there may even be qi and blood stagnation. Dryness may damage the lung, causing failure of the lung to disperse the qi and body fluids. As a consequence, the channels and blood vessels are not properly nourished, the qi and blood circulation slows, and so pain follows. Next is the emotional factors. Is it often a clear fact that sometimes the pain such as headache, neck pain, chest pain, abdominal pain, etc. gets much better when the patient has a very positive attitude, and it may become much worse when there is a negative emotion. There are several emotional factors in traditional medicine: joy, anger, melancholy, worry, grief, fear, and fright. These factors may cause direct dysfunction in the jiang fu organs, disturbing internal qi and blood circulation, so that the qi and blood stagnate and pain follows. For example, excessive grief may slow the qi circulation in the lung, so the lung cannot properly disperse the qi and body fluids. This causes both stagnation of qi and blood and formation of damp phlegm, and pain develops. Another example of this is anger. Too much anger may prevent the liver from maintaining a pre-qi circulation through the body, and stagnation of qi as well as of blood occur. In addition, qi stagnation in the liver may cause stagnation of qi in other organs such as the lung, heart, and spleen, leading to blood stagnation and accumulation of damp phlegm as well. All these situations bring about pain. And now we are moving on to the internal organ diseases. The circulation of qi and blood in the body should be constant, just like the continual courses of the sun and moon. According to traditional medicine, this circulation depends on the correct, interdependent functioning of Zhang Fu organs, including the lung, heart, liver, and kidney, as well as triple burner. Those Zhang Fu organs directly or indirectly contribute to the free flow of qi and blood in the body. For instance, the lung disperses the qi through every part of the body and also connects to the blood vessels, keeping the qi and blood circulating freely in the body. The liver is in charge of keeping the qi circulating freely, which in turn keeps the blood circulating freely. The circulation of liver qi also promotes the digestive functions of the spleen and stomach, and this keeps the water passages clear, so preventing the accumulation of damp in the body. That's why if there is dysfunction of any of these organs, there will be retardation of the qi and blood circulation, eventually causing pain. And finally, miscellaneous pathogenic factors. Miscellaneous pathogenic factors include bad diet, visit trauma, and improper exertion. Firstly, bad diet. Bad diet suggests overeating raw and cold food or fatty and fiery food, maybe over drinking ice cold drinks or heating beverages, etc., may disrupt the ascending and descending of qi in the middle burner. This can lead to a slowing down in the qi circulation. Then qi stagnates and pain will be the result. A bad diet may also make the qi and blood deficient, causing under-enrichment of Zhang Fu organs, channels, muscle, tendons, bones, and blood vessels. As a result, pain of deficient type may occur. Besides, a bad diet can create damp to develop in the body, causing the channels and blood vessels to narrow, leading in turn to stagnation of qi and blood. Secondly, physical trauma. Physical trauma may cause direct injury to the muscles, tendons, bones, channels, and even internal Zhang Fu organs, also leading to stagnation of qi and blood, or damage to body tissues. Finally, improper exertion. Overstrain, overindulgence in sex, and excessive study may all exhaust the qi and blood, leading to their deficiency. Therefore, pain occurs caused by under-nourishment of the body. Too little physical exertion and living too luxuriously may also slow the qi and blood circulation, leading to pain resulting from a gradual stagnation of the qi and blood. There are a lot of causative factors leading to pain. In clinical practice, we can distinguish the causes by determining the location of pain, the level of pain, and the characteristics of pain. An example of the location of pain. Lower back pain is often caused by invasion of external pathogenic factors, stagnation of qi or stagnation of blood, and deficiency of the kidney axon, while elbow pain is often caused by invasion of external factors and overstrain or physical trauma. Now, let's summarize what I have discussed today. Pain is one of the first human complaints occurring in daily life. When there is not enough qi and blood, or when they are stuck in one area, the pain will develop. Causative factors of pain include pathogenic factors, emotional factors, internal organ diseases, and miscellaneous pathogenic factors. In clinical practice, practitioners can distinguish the causes by determining the location of pain, the level of pain, and the characteristics of pain. And that's all I want to say in this video. Thank you so much for watching and see you next time.